Hello, everyone. My name is Valen. I am honored to join you today and have the opportunity to share my patient perspective of what it's like to be on the other end of an operation and the opportunities I've been afforded because of the incredible surgeons in my life and the life-saving and life-changing work that all of you do. My patient journey began with my very first memory, which is when I had a grand mal seizure at 5 years old. I've endured over 30 operations and have more than 60 inches of scars crisscrossing my body. I've endured a wide array of procedures, from ports being placed, the removal of my gallbladder, endoscopic procedures, and skin cancer removed, to name a few of the small ones. However, I would like to share my patient story by highlighting several defining surgical moments in my medical journey, moments when my surgeon showed aptitude, bravery, and conviction, and how these moments set me on the course to live a longer and healthier life. My first big surgery taught me the extraordinary aptitude of a surgeon. In middle school, I was diagnosed with scoliosis. I had a severe S curvature in my spine. It was determined that a brace wouldn't help and surgery was necessary. Bone was taken from my hip and Harrington rods were placed along my spine. I had a 6-month recovery and did well for many years after this surgery, actually until I was in my early 30s when a disc herniated. That led to a discectomy surgery and also a spinal fluid leak. I had a very long, exhaustive recovery that wound up leading to chronic pain that I deal with daily. I navigate as best I can. And when looking at all of my health issues, this is actually the one that causes me the most challenges on a day-to-day basis. However, I'm grateful for all that I was able to do throughout my teenage years and when I'm in my 20s and 30s because of the first surgery that I had. And I'm also really thankful for the continued relationship and support of Dr. Trina Fellow, who performed these back surgeries. I learned how amazing surgeons are and became in awe of the aptitude of my surgeon and how he had to execute this operation with such precision in order for it to be a success. Along with aptitude, next I learned of the bravery of my surgeons. I was diagnosed with polycystic kidney disease when I was 10 years old. I inherited it from my mother's side of the family, and the oldest to survive is my mom at 65. Everyone else passed away before the age of 53. I was in and out of the hospital a lot with cyst bleeds. As you can see here, this is an MRI of both of my kidneys, which were the size of footballs and polluted with cysts. I had a lot of issues with cyst bleeds, had surgeries to try and stop the bleeding, and nothing really could help. And when I started college, I became very ill. I went to the hospital for 3 months straight, and they gave me transfusion after transfusion for these cyst bleeds. Got to a point where they just kind of put their arms up and told my parents they weren't really sure what to do. Well, that answer wasn't good for my parents, of course, and they transferred me to another hospital where I stayed for another 8 months. They did testing and determined that they too couldn't do anything for these cyst bleeds. And even though my kidneys were working 60%, they decided to remove both of them, and I was immediately placed on dialysis. At this point, I was too sick to be placed on the transplant waiting list, but I needed a kidney to survive. I needed a living donor to step forward, and I needed a bravery of a surgeon to transplant me in such an ill state. Fortunately, this is when Dr. Robert Montgomery came into the picture. He said he saw a light in me, and he was not going to let a teenager die. Sally, a close family friend who is pictured here in the middle, stepped forward and donated her kidney, and Dr. Montgomery on the right took the risk of transplanting me. And this was just extraordinary how everything seemed to just come together after this. This missing piece, once I received a transplant, seemed to heal all the other ailments that had happened throughout my long stay in the hospital. It took Sally, my kidney donor, and Montgomery for making this bold and brave decision in order to save my life. My kidney transplant was 19 years ago, and I'm grateful to say that I still have the same kidney and it's doing great today. I credit my surgeon's aptitude and bravery to why I'm still alive, and I'm grateful for our continued friendship to this day and the important role that he played in my journey. Dr. Lipset taught me of the importance of conviction. 2 weeks after my kidneys were removed, I started to bleed internally. I lost 11 units of blood in one day. They did three endoscopic procedures, one day after the next, using a bigger tube each time to try and find the source of my bleeding. They did an emergency surgery and found a bleeding vessel in my stomach and 4 bleeding ulcers. In order to determine this, they had to reopen the long incision across my abdomen from the bilateral nephrectomy I had 2 weeks prior. When they went in and saw this, the surgeons wanted to remove my stomach. It was Dr. Lipset who stepped forward that day and said, "You are not going to remove her stomach after both of her kidneys were just removed." It is because of her conviction that I still have my stomach. She refused to accept an inadequate outcome. Her passion, dedication, and determination is why I am healthy and have a stomach today. I still stay in touch with her, and when I eat a really delicious meal, especially around the holidays, I think of her and I send her messages and give her thanks for the decision she made, how much I appreciate her. I did really well following my kidney transplant. I led a very healthy and fulfilling life. However, 14 years after my kidney transplant, I became very ill again. PKD wound up causing bile duct plate malformations in my liver. It led to liver infections and sepsis infections. I kept getting sepsis over and over again, and I needed a life-saving liver transplant. Once again, my situation was unique. My liver was technically functioning, just like my kidney was functioning at 60%, but it was the bile ducts and the infections that were causing me to need a liver transplant, kind of like the cyst bleeds were causing me to need a kidney transplant. Doctors just didn't know when the next sepsis infection would come and if I'd survive it. The wait for a liver in California, where I live, was 1.5 years, and my hepatologist said she just didn't think I'd survive that long of a wait. She suggested I get dual listed and recommended that I go to Barnes-Jewish Hospital in St. Louis, Missouri. That is when Dr. Chapman came into the picture. At the time, I was on daily IV and oral antibiotics to try and suppress these infections. As optimistic as I am, I couldn't help but question how much could one body handle. And I had the thought that there wasn't dialysis for a liver transplant. With a kidney transplant, you have dialysis, this bridge to try and keep you alive until you receive the gift of life. And that doesn't exist for a liver transplant. It really scared me. I went through transplant evaluation at Barnes-Jewish Hospital and just was in awe of the center and Dr. Chapman and how calming and reassuring he was. So my husband and I temporarily relocated to St. Louis, and I'm so grateful to say that 3 years ago, I received a liver transplant. I was fortunate to receive a second miracle. The recovery went better than I could have ever imagined. I credit that to the amazing team and care and my support system. And looking at these pictures is just incredible to me. On the left is 6 days after my liver transplant. I saw Dr. Chapman right before I was discharged from the hospital. In the center is me several days after my liver transplant and the huge incision. And then there's me and Dr. Chapman on the right, 1.5 years after liver transplant at the 10,000 transplant gala at Barnes-Jewish Hospital. The transformation that it just is shown there. It's just hard even for myself to believe. And I'm just so grateful, so grateful. I feel like Dr. Chapman embodies all the incredible qualities that I've learned from my surgeons throughout my journey. I was so concerned to have such a complex case and having so many surgeries leading up to this huge liver transplant surgery, and him having the aptitude to perform this huge surgery on an abdomen of my own, which has endured countless surgeries, was just incredible. The bravery to take on such a complicated case as myself just really meant a lot to me. The responsibility that he and his team and myself had to care for a kidney transplant while going through a liver transplant was just huge. And the conviction that he had and the passion and dedication that I could feel was so reassuring to my husband and I that everything was going to be okay. I credit Dr. Chapman and my living donor for why I'm alive today and the healthiest and happiest I have been in years.